Hello everyone, my name is Abby Rose Nichols, and I am the Marketing and Communications Specialist here at Cenla Pregnancy Centers. For those of you that haven't heard of us before, we are a nonprofit organization that supports women in unplanned and crisis pregnancies with confidential services at no cost. We have 3 centers. Our main center is located in Alexandria, Louisiana, with our 2 satellite centers, one in Marksville, Louisiana, and one in Vidalia, Louisiana. Safe Haven. What is it, and how does it protect mothers in crisis? You may see sometimes in the news stories of a mother abandoning her baby on a stranger's doorstep or leaving her baby in a gas station bathroom in a moment of crisis. This may be due to multiple factors, such as a mental health crisis, postpartum depression, limited support, or financial struggles. Child abandonment is a criminal act, which is why it's important for our community to remain aware and educated that a law such as the Safe Haven Law exists. So, what is the Safe Haven Law? The Safe Haven Law was a law passed in the 2000s, which created a confidential safeguard for mothers and babies in crisis. This law was created to protect the privacy of parents and the safety of babies by offering an alternative for parents who choose to surrender their baby and relinquish their rights. So instead of a mother leaving her baby in crisis in an unsafe condition, such as a gas station bathroom or a stranger's doorstep, she can surrender her infant under the Safe Haven Law and be covered legally. According to the Department of Children and Family Services, if you are unable to care for your baby and the baby's well-being is in danger, you can bring that newborn up to 60 days old to a designated emergency facility or safe haven site. By leaving that baby in the care of an employee at that facility, parents can give up custody of the newborn with no questions asked. Parents are not required to give any medical information, their names, or the reasoning behind why they are surrendering their newborn. There must also be no signs of abuse or neglect to the child, and they must be left in a designated safe haven location. We're going to cover that now. According to the Department of Children and Family Services, the following locations are safe haven locations in the state of Louisiana, and that includes any hospital that is licensed in the state of Louisiana, local or parish public health units, licensed rural health clinics, licensed ambulatory surgical centers, federally qualified health clinics during their normal hours of operation, any manned fire station, any manned law enforcement station, or any child advocacy center that is accredited by the National Children's Alliance during their normal hours of operation. If parents are unable to travel to any of the designated safe haven locations, they can call 911 and a law enforcement officer, firefighter, or EMS provider will be dispatched to confirm that safe haven relinquishment and transport the newborn to a local hospital. I will also be including a link in the comments below. Once you click this link, it will bring you to a website, and if you are in the state of Louisiana, you can enter your zip code and it will pull up the nearest safe haven location. By surrendering your baby into the arms of an employee, and as long as the surrendered child is 60 days old or younger and shows no signs of abuse or neglect, no mother will be charged with a crime such as child abandonment. It's important to note that there are safe haven baby boxes that are available in some states. These are physical boxes that are built into buildings and communities, such as a fire station or a hospital. These also serve as safe haven locations. To clarify, Louisiana does not currently have a safe haven baby box, but there are the designated safe haven facilities as mentioned earlier. There have been over 125 surrenders that have resulted from calls to the National Hotline for Safe Haven Baby Boxes. If you are a parent in crisis, you can call the hotline that is provided on the screen. Once an infant is relinquished, they will be brought to a hospital where they will receive any medical attention that they need. There, they will be screened for any signs of abuse or neglect. Following this, DCFS, which stands for the Department of Children and Family Services, will find a family who can care for the surrendered infant. Oftentimes, this is a trained foster family. The state will then begin proceedings to obtain custody of the child and safely and legally place that baby in a permanent adoptive family. As long as the baby is left in a designated safe haven location, is 60 days old or younger, and shows no signs of abuse or neglect, parents will be covered by the safe haven law and will not be considered guilty of a criminal act such as child abandonment or neglect. According to Louisiana law, neglect is defined as the refusal or unreasonable failure of a parent or caretaker to supply the child with necessary food, clothing, shelter, care, treatment, or counseling for any injury, illness, or condition of the child, as a result of which the child's physical, mental, or emotional health, welfare, and safety is substantially threatened or impaired. If a parent changes their mind, they still have the legal right to seek to reclaim their parental rights within 30 days by contacting their local DCFS office. For parents who are not specifically in crisis, but who wish to surrender their child and relinquish their rights, adoption is another alternative. Although Cenla Pregnancy Center is not an adoption agency, we do offer referrals for adoptions. You can call us at the number provided on the screen. We want to thank you for watching this video today. Make sure to hit the subscribe button for more educational content, and you can also follow us on our Instagram and Facebook for more.